I think bipolar is fluctuations between states of extreme euphoria and manic depression, almost to the point where you can't even partake in basic everyday activities.
Ek dink die geesteongesteldheid bipolêr is wanneer iemand van een by byvoorbeeld 'n slegte by na 'n goeie by toe kan gaan en ook 'n mengsel van daai twee hê op dieselfde tyd.
Either one end of them being really depressed to another end where they're ecstatically happy or have a feeling of euphoria.
Split personalities. Umyeni is alright, happy, and then the next alright. Like uba nomsindo okanye afuna usihlalela yedwa and yenzeka in a split second and abakwazi uzinceda because into idibene into esengqondweni. And at the same time ndicinga ukuba ngumntu bayaboniswa abantu bipolar.
Essentially, to me, bipolar means that it's when a person alternates between sustained periods of depression and anxiety, and then sort of alternated with extended periods of euphoria and hysteria.
Bipolar disorder is best described as a neurological disorder in which an unusual shift in many facets of one's mind and abilities occur. These shifts present themselves in a physical manifestation such as a sudden rise or drop in energy and activity levels, as well as a manifestation experienced more personally by the sufferer, such as a sudden change in thoughts and moods for no apparent reason. These sudden, yet expected by the more veteran sufferers, changes can go as far as to inhibit a person's ability to complete relatively simple daily tasks, such as getting out of bed. The signs and symptoms of a manic or depressive episode. When an individual is experiencing a manic episode, they may display some of the following: feeling very up or elated, or a sense of euphoria, having energy levels that are much higher than usual, an increased activity level, trouble sleeping, speaking about many different things at the same time. They feel as though their thoughts are running faster than they're able to keep up with. They have high levels of agitation or irritability, extreme multitasking, and they often partake in risky behaviors such as risky sexual activity, driving recklessly, or excessive spending. Individuals who experience a depressive episode could display some of the following: feeling very sad, down, empty, or hopeless, having decreased energy and activity levels, experiencing little, excessive, or the inability completely to sleep, have trouble concentrating, they feel hopeless, empty, forgetful. They hardly eat or they eat in excess, goes from one extreme to the next. They often feel tired and run down. Their suicidal thoughts or thoughts surrounding death and all its facets seem to increase. It is possible for an individual to feel both manic and depressed during an episode. This is then referred.
The three main factors of distinction are: number one, interference. If your daily life is severely disrupted by extreme moods, it is likely to be bipolar disorder. Second is length. If a bad mood isn't gone within a few days, it is usually mania or depression, which can last for weeks or even months. Thirdly, intensity. Bipolar disorder mood swings are usually more severe than ordinary mood swings.
Let's say the y-axis is mood, with mania and depression being on the far ends of the axis, and the x-axis is time. The average healthy individual might have normal ups and downs throughout their life, and they might even have some pretty serious lows once in a while, maybe after losing a job or moving to a new place and feeling lonely. An individual with unipolar depression, though, might have normal highs, but they'll probably also have some crushing lows that last for a long period of time and might not even have an obvious trigger. Now, for the bipolar disorders, the first one is called bipolar 1. And these are people that have some major lows that last at least 2 weeks, and then some major highs that last at least a week or require hospitalization. That said, untreated manic episodes can last as long as 3 to 6 months. The second one is called bipolar 2, and this is when a person experiences similar lows and has additional highs called hypomania, which are less severe manic episodes than we see in bipolar 1. To qualify for a diagnosis, these hypomanic states need to last at least a week. Once again, though, these symptoms generally last a few weeks to a few months. All right, and the third one's called cyclothymia, or sometimes cyclothymic disorder. And these people have milder lows as well as milder highs, or hypomania like you see in bipolar 2. And they cycle back and forth between these two over a period lasting at least 2 years.
Bipolar 1 refers to a condition that is characterized with experiences of one or more manic episodes or a mixed state that can be caused by any other condition. Bipolar 2 refers to a condition that requires a person to have at least one hypomanic and one major depressive episode, with possible periods of a level mood in between these episodes. Individuals with bipolar 2 disorder generally only seek treatment for major depression because the hypomanic episodes are mistaken for good days. The problem with this is that the antidepressant can trigger a high that cause frequent mixed cycles because a mood stabilizer is not prescribed.
If you have been diagnosed with depression that goes away periodically and then returns, ask yourself these questions. Did you, for periods lasting 4 days or more, have high social levels and slept less? Were more hyper and had trouble concentrating? Were irritable or quick to anger? And participated in pleasurable activities that you wouldn't normally do? If you answered yes to 3 or more of these questions, you should consider consulting your health practitioner. Because bipolar disorder has recurring mood cycles, it needs a comprehensive treatment plan that focuses on direct crisis management of mania or depression, as well as a long-term preventative care plan.
Two main stages are involved in the treatment of bipolar disorder: the acute stage and the maintenance stage. In the acute stage, the main goal is to reduce or eliminate severe manic or depressive symptoms. This is usually achieved using psychotherapy, using medication, hospitalization, or electroconvulsive therapy. The maintenance stage, however, focuses more on maintaining a stable mood in order to reduce or decrease future episodes of depression or mania. It also focuses on creating recovery plans in social relationships and self-care environments. This is usually accomplished with the use of medication, rehabilitation, education and support therapies such as cognitive behavioral therapy, interpersonal therapy, and family psychoeducation.
Although bipolar disorder management begins with professional medical treatment, there is a wide variety of other coping methods a person can make use of throughout their journey.
Important coping strategies. Educate yourself and your family members. It is the first step into understanding what you are experiencing and why. Take responsibility. Stay positive. Positivity is a key component needed while experiencing any disorder. Build a strong support system. Studies have shown support from close relationships increase the recovery rate and minimize the chances of the disorder escalating into something more serious. Lastly, hope. Having hope and believing in oneself may just be the magic ingredient needed to remain on your path of recovering and coping.
Monitor your symptoms and moods. Reach out to other people. Develop a daily routine. Keep stress to a minimum.
If you're suffering from bipolar disorder, you must generally watch what you put in your body. This is what you can do for yourself. Firstly, follow your prescribed medication. It can become dangerous if dosages are not followed, which may even lead to longer recovery or start a different disorder. Secondly, stay away from drugs and alcohol, as drugs such as cocaine, ecstasy, amphetamines can trigger mania, while alcohol and tranquilizers can trigger depression. Even little or moderate drinking can upset your emotional balance. Lastly, live a balanced and healthy lifestyle. Although these tips should be followed regardless of the existence of a disorder, living a healthy and active lifestyle ensures positive as well as individual growth.
Always encourage the patient to follow their medication routine. Try to include them in things you are doing rather than doing things for them. It is of vital importance to know the difference between a patient having a manic episode and having a good day, or a depressive day and a bad day. It is important to encourage the patient to consult a doctor if they are not feeling themselves or have had bad side effects. Set boundaries. Look for support groups. Don't be afraid to ask for help. Don't take all reactions too personally, as a person may be aggressive when manic or irritable when depressed. Understand your limits.
Interpersonal and social rhythm therapy. The sensitivity bipolar patients have to social mechanisms is known as their internal clock. Bipolar patients have been known to have a highly sensitive internal clock, which makes normal social tasks almost impossible to complete. The ways in which families can help overcome this high sensitivity is by being educated to recognize mechanisms which set the patient off and attempt to avoid the situation until the patient is ready. The family's ultimate aim is to assist the patient in readjusting and handling social mechanisms. Another method of treatment incorporating the family into this phase is that of family-focused therapy. Dysfunction within the family household is a high causation of rehospitalization in bipolar patients. Through the aspect of therapy sessions with focus on the family and their functionality, with an undertone of respect towards the patient with bipolar disorder, they will be able to minimize the risk of rehospitalization. The aim of the multidisciplinary team approach is to help minimize rehospitalization of bipolar patients by educating their families on how to assist with the treatment phase. As for the patient, the ways in which the patient deals with their symptoms or the varying degree of their highs and lows relates to the patient having a multi-axis diagnosis. A patient with bipolar disorder and a contributing multi-axis diagnosis can be a lot to handle for one practitioner, and this is why extra support during the treatment phase is brought in through the use of families. Families are educated on how to assist with this phase. Through the multidisciplinary team approach, the family can play two major roles within the treatment phase, this being the therapeutic role, which is aiding the patient in readjustment to social norms, or a guidance role, by eliminating dysfunction in the patient's life by avoiding predominant symptoms. However, the family is not to replace professional care, merely assist in the treatment phase.
Bipolar disorder is a lifelong illness that is associated with greater morbidity and mortality rates than unipolar depression, and often leaves devastating consequences for both people diagnosed with the illness and their families. With increased research on treatment and improved understanding of how the burdens of patients and caregivers can be reduced through psychosocial support, this burden can be reduced.